Well, this is the book that I brought to Wednesday's debate, filled with hundreds of hours of research. But we didn't get to all the topics, and figuring that good debate questions are a terrible thing to waste, we want to continue the conversation now with former Speaker Newt Gingrich, one of Trump's top advisors, and author of the new book, Treason, and key Clinton advocate, Democratic Congressman Xavier Becerra. Gentlemen, welcome back to Fox News Sunday.
Chris.
One subject that we discussed in the debate was immigration, where Trump and Clinton are sharply divided. Take a look.
Well, first of all, she wants to give amnesty, which is a disaster and very unfair to all of the people that are waiting in line for many, many years. We need strong borders.
I don't want to see the deportation force that Donald has talked about in action in our country.
But we didn't get to the issue, which I was planning to, of sanctuary cities, cities that limit their assistance to federal immigration officials on people who are in this country illegally. Donald Trump would cut off federal subsidies to those cities. Hillary Clinton supports those cities. Debate your differences.
Chris, I will simply say that Hillary Clinton has a record when it comes to tough border enforcement and enforcement in our cities as well.
But I'm talking about sanctuary cities.
Well, sanctuary cities don't stop you from going after the criminals, the folks that are trying to do us harm. Sanctuary cities simply says we're not going to focus on going after the women in the grocery store or picking up their kids from school. We should be focused on going after those who are trying to do us harm. And that's all that sanctuary cities talk about. Going after sanctuary cities, as Republicans have, would deny our local law enforcement the resources they need to actually continue to go after criminals on the streets. And that's why many of us have opposed the Republicans' efforts to try to undo funding for cities that have sanctuary city policies to protect women and children.
Speaker Gingrich?
Well, I mean, first of all, since Secretary Clinton basically doesn't intend to enforce the law nationally, why should she care if cities enforce the law? She has said openly that she had, her dream was of a Western Hemisphere without borders. In that circumstance, sanctuary cities wouldn't need to exist because you'd have a sanctuary country. There's a huge difference between Trump's desire to control the border, her desire to open the border, and I think the sanctuary city issue is just a part of that. But my impression, I mean, Congressman Becerra knows a great deal more about this than I do. My impression is that in a number of cities, they will not turn people over to the federal government, even if they are picked up for criminal violations.
Well, let me talk about one. Let me talk about one specific case that got a lot of attention. That, of course, is the case of Kate Steinle in your state of California, who was shot to death last year in San Francisco. Her accused killer had been deported 5 times, but he was back in the U.S.
Right.
And he does not qualify for sanctuary city policy. That's the point. No, he wasn't. He escaped. He was able to get away, and then he was able to get a hold of a weapon. But he was not under some sanctuary city policy. And by the way, open borders was not a reference to immigration by Secretary Clinton. It was a reference to energy policy.
No, wait. No, I got to stop you there because that was one of the I wish I'd had back in the debate. She talked about a common market with open borders and open trade. There's no such thing as an electrical common market.
She talked about the fact that our energy policy must go beyond our own borders because otherwise we're going to
that wasn't what she said. She talked about a hemispheric common market. Nobody talks about common market.
You and I and Newt can go ahead and decide what we think she said, but she's the one that told us what she said. She said it.
Yeah, but the actual phrase, it's just interesting. The actual phrase is open trade and open borders. Now, in that setting,
continue to energy policy.
But anyway, to go back to the case, as I understand it, the city of San Francisco didn't turn this guy over. There's a piece in San Diego, local TV, runs like 7 minutes, covering the border right now. They don't turn people back. They actually take them to a trolley car in San Diego. People actually run up to the police. One guy who's a border patrolman said the guy runs up to him and says, "I have a really bad heart condition. Can you put me in the hospital?"
All right. I also wanted to talk to Trump and Clinton about Obamacare, but somehow we got sidetracked into a debate about TPP and dumped Chinese steel. So let's talk about Obamacare. Speaker Gingrich, for all the criticism of the Affordable Care Act, the fact is that 20 million Americans who didn't have health insurance coverage now have health insurance coverage. What happens to those 20 million people under Trump's repeal and replace?
Well, first of all, most of those people are in Medicaid. They're not in insurance programs that are private. Second, a lot of people who are in insurance programs are going to be out of them by next year.
But they're only in Medicaid because Medicaid was expanded under this.
So Medicaid is expanded. That's a simple government program to expand.
So Trump would continue with the expanded Medicaid?
I suspect nobody would be kicked off in the transition, but the people who are going to be kicked off now are people who cannot afford the scale of the increase in premiums and the scale of the increase in deductibles. I mean, this is the Unaffordable Care Act. It's a joke to say it's the Affordable Care Act.
What's the plan to protect those people?
I think the plan will probably involve a fairly large tax credit to enable them to buy private insurance.
Chris, there we go. 6 years after we passed the Affordable Care Act and 20 million people now have coverage, this is the plan. It's not a plan. Suspicions about what you think will happen aren't going to get people access to a doctor or a hospital. People used to go broke having to file bankruptcy because they had taken their son or daughter to a doctor or a hospital. That's no longer the case for people who have insurance. 20 million people today have the security of knowing they don't have to wait until their child is so sick they can go to the emergency room.
Congressman Becerra, you would certainly have to agree. Bill Clinton said Obamacare right now does have serious problems. The big insurance companies are pulling out of a lot of states. There's almost no choice in a lot of the markets. Premiums are going up an average of 9%, but in some places 20, 30, 40%. Secretary Clinton is saying, let's let people under 55 buy into Medicare and let's put out a public option. So it seems that her answer is let's let government have a bigger role or maybe the role in health care.
Well, remember, what she has said is we can make improvements on what has already given 20 million Americans coverage. We have more Americans covered today than ever before, and what we can do is continue to make progress based on a system that relies on the private sector, not on our government.
She's talking about a public option.
For those states, there are many states where the private sector is not going in, rural areas especially, where a public auction absolutely would make a difference because it gives Americans more choice. But rather than throw away everything you've got and go back to the days of pre-existing conditions where you could not get coverage,
let me wrangle this one.
First of all, I think the term that President Clinton used was crazy. He said this is a crazy scheme.
Well, in fairness, he was only talking about specific problems there, not the whole thing.
Yeah, the people who are sandwiched.
But the specific problem in the end is you have a program that's not affordable. There's not enough money. You have insurance companies dropping out. Hillary, in one of her secret speeches, said she really likes the Canadian model, which is a government-run system.
What's the plan? What's the plan?
I think the plan has to be to go back to making it possible to have competitive choices, and the plan has to be, frankly, to take a lot of the cost out of health care.
Okay, how? It's great to say what we have to do, but show me how you do it. Republicans have 6 years. They haven't come up with a plan.
I think the first easy step, although it'll be a big war politically, is malpractice insurance. You look at the amount of defensive medicine practiced in this country, it drives up the cost. What you're trying to do is say, we can have an endless increase in cost, but it will be affordable.
So you wait, till the doctor has done something wrong to sue for malpractice. That doesn't make you well.
That's true. It doesn't make you well. Finally, Speaker Gingrich, we're running out of time here. You've been speaking recently about Big Trump and Little Trump. Yes. And Big Trump, you say, is a man who's espousing historic change. And Little Trump, you say, is, your words, petty and pathetic. Can we afford to have a president with such a split personality?
Look, of course you can. I mean, I think we had a number of presidents who had interesting challenges in their personality. But the question is, I'm willing to concede that Trump on occasion is crass, but I'd like my opponents to concede that Hillary on occasion is corrupt. I mean, you have a candidate for president who under any reasonable standard would have been indicted. You look at what's just happened to General Cartwright. You have a candidate for, you just raised this with Robbie Mook. You have a candidate for president who is cheerfully dealing with foreign governments for $12 million donations. She's surrounded by staff who are basically saying, take the money. And that's what's going to walk in the White House. So Trump is not perfect, but she sure ain't perfect either. And she's a much greater threat to our system than Donald Trump is.
Speaker Gingrich, Congressman Becerra, we're going to have to leave it there. Thank you both. And it's always good to moderate your, I think I had a little bit more control here. And I think we got some answers. You know, like I said, debate questions are a terrible thing to waste. Thank you both.
Thank you.